Hello. Did you miss us this morning, Beth?
Yes. It was weird. I kept looking at the clock.
Yeah, me too. I got so much stuff done this morning. Wow. So did Keith.
Dang right, I've been busy. I have been busy. We got our team put together, George. We're ready to rock and roll. Suzanne, I thought you were on spring break.
I am, but I'm driving up to Georgetown right now for a meeting. So generally, yes, except for a few things.
How are the
So
roads?
right now they're just wet. They're fine.
Okay, good. My
Yeah.
daughter's driving up this afternoon. I think it'll be fine. So George, Sean just sent an email reminding us that he's going to be tied up at 11. So I don't think he's going to be joining us this morning. Okay, thanks.
Thanks. I had forgotten. I did send Randy a text, and Keith, I don't know if you have anything, if your manager update item is a must do this week or not.
I mean, I've got some things that I can certainly share to fill up 5 minutes if we need to, or not.
Okay.
I was going to say, it looks like 5 minutes may fill up in and of itself. So there's nothing pressing, I don't think.
Okay.
Did you, George, did you text Randy?
I did. Morning, Tim.
Hello.
Tim, you look 30 years younger.
Yeah, I don't feel it.
Rumor is he tried a new face cream that his wife had given him.
Yeah. I'd like some of that face cream. If you have it.
I used it all up. My face is so big.
Okay, so we're still waiting for one more person. We'll give them a minute or so here.
Mhm.
George, if you'd like, I just got a couple updates that Randy's already aware of, but just for the public and the rest of the team here, I can provide a little bit of information.
Please.
Uh,
Oh, well,
I wasn't sure what she was doing there. Oh, there's Randy.
yep.
So allow me to break in right now and say, I'm sorry, I was down here working till about 10:50 and I ran up to run some dishes and got carried away and lost track of the time doing some cleaning. So my apology.
No worries. It happens to the best of
Tomorrow.
us. So this is our regularly scheduled Board of County Commissioners meeting. It's March 30th. It's 11 a.m. The first thing on the agenda is public comment. We do this as a matter of tradition. So if anybody has a comment they'd like to make, you can go ahead and click participants, click raise hand. We'll bring you over and hear you out. Okay, not seeing anyone. And Keith had already stated that the county manager updates, there's nothing he needs action on right now, or direction is maybe a better term. So the only remaining thing on our agenda is the COVID-19 update with Tim Ryan and Suzanne Bocha. So Tim, the floor is yours.
Thanks, George. So we'll start as we usually do with the numbers. National trend, we are now at 30+ million confirmed cases across the US. Our case rate, the average daily number of new cases has increased over the last week across the entire country. The number of new cases now in excess of 65,000 per day as a 7-day average. Hospitalizations continue to be high and actually increased over the last week. Fatalities, we have now lost 550,000 plus Americans over the last year. Our current rate is 995 per day as a 7-day average. And just for the record and for clarity, 550,000 is more fatalities globally than from flu. Just to put in that perspective. Test positivity rate is at 4.8%, also an increase from last week. Major contributing factors to the spread. Lack of mask wearing, belief that the pandemic is over, travel, just general malaise with the entire situation. Unfortunately, that doesn't make it go away. The Colorado trend, similar. The case rate, current number of daily cases has actually gone up over the last week, now in excess of 1,170 per day as a 7-day average. Our 2-week cumulative incident rate has actually gone, in addition, has gone up to 243 per 100,000. Hospitalizations continue to decrease, although that is plateaued. The currently 28% of ventilators are in use, 2% of hospitals anticipating ICU bed shortage, and 8% anticipating staff shortage in the next week. The number of current hospitalized patients has actually slightly gone up as a sum total. It's at 382. Our test positivity rate has gone up as well across the state. It's now at 6.8%. Major contributing factors to spread. lack of mask wearing, social gathering, travel, a significant increase in number of folks from outside the state. Vaccine update, the only really good news I have for you today. We have vaccinated 1.6 million plus folks with at least one dose, and 969,000 plus folks with 2 doses are fully immunized. In Clear Creek County, this story is the same. Our case count over the last 7 days is at 1021 in the last 2 weeks and 399 to date. Our hospitalizations actually went up by 1. Fatalities holding steady at 2. Our cumulative incident rate gone up significantly. It's now at 215 per 100,000. Our 2-week test positivity rate is at 6.2. Major contributing factors, same as everywhere else: social gatherings, lack of mask wearing, travel. Testing updates, we continue to test. The community test site today was canceled due to the weather. But it is an ongoing venture every week on Tuesdays in Idaho Springs. We are in addition testing again at the jail and at the school, both students and staff. Vaccine update, we vaccinated a little over 2,600 folks with at least 1 dose, 1,100 plus with 2 doses, and the 1,500 fully immunized with the J&J vaccine. Any questions, comments, concerns?
Yeah, I have a question. So I know in the public health order, it says that counties under 30,000, I believe, are no longer using the case rate, the per 100,000 case rate, but they're using a hard case count. It doesn't say what those thresholds are in writing in the order. I'm curious if that's been communicated to you.
It has. It's not written anywhere for a whole host of reasons. One for which you would ask CDPHE that question. Yeah. So they haven't published it. I'm not going to publish it because they haven't published it. So, but it is what it is. We are still in blue, given our increase in the county.
Okay. I mean, one reason why you would want to have that information be publicly available is so that people know what's coming. And I'm one of those people. I don't know what 10 cases means as far as where we're going on the dial. And I think the expectation is that we partner with the state in making those decisions. And without that information, I can't.
Well, I think if I had to guess, I think CDPHE hasn't published it because the governor is intending on getting rid of the dial and everything else in the coming weeks, and following suit with Texas and Florida and every other state that's going up in case counts. So I don't publishing it and putting it out there. CDPHE hasn't published it. I've been verbally told what it is, but they haven't published it. So I can't publish something that isn't published by them. Anecdotally being told something, I don't want to put that out there. The case count itself, we're not going to move into yellow. We would have to more than double or triple our case count to get into yellow. So I think you should take comfort in knowing that we're basically going to be in blue for the foreseeable future, unless the experts are correct, which my money's on them. Our numbers in this state and country are going to go through the roof here in the coming weeks.
Okay. Well, that's, I mean, I guess the information I needed as far as how we're moving on the dial is covered. So thank you for that. Maybe I'll just pause there, see what Randy's got for us.
I don't have any questions on the report at all. I mean, I tracked last night, I went on and looked at where we were, and I saw that our count again this week is low. It looked like we dropped back down from where we were a little higher. So it seems like we're in a pretty stable position right now. And that's what I just heard Tim say, so.
Yeah, I mean, we're higher than we have been. We're at 10 to 11 cases per week. That's 3 or 4 cases up each week from prior months. And I know Sean likes to ask the question, but he's not here, but I'll answer it anyway, even though he didn't ask it. He likes the breakdown, the age breakdown. So just to give people a sense of what's going on, and I'm happy to give you my professional interpretation of what is actually going on in this country. So in the last 2 weeks, we've had 1 teenager positive, 5 20-year-olds, 7 30-year-olds, 6 40-year-olds, 5 50-year-olds, no 60-year-olds, and 1 70 plus. Right now, the UK variant is absolutely out of control. It is taking over, as was predicted by all. And so folks are going out, and we have, in addition to that, in the last 2 weeks, 10 folks who've been vaccinated who are now positive. The way that happens is either they're exposed prior to getting vaccinated, and or they were exposed just after getting vaccinated in that 2-week window where your body hasn't fully appreciated what you've just given it. So my word to caution to everyone, this pandemic is not over, despite the politicians' desire to make it so. It is not going to be over anytime soon. Yes, we are vaccinating folks across the country at a record rate. But unfortunately, the variants are far quicker than humans, and they are outpacing the current vaccination rate. It's why 20 states in the United States have a 10% or more increase over the last week. And another 10 states have an increase, including Colorado, from the prior week. So when you have the 20 and 30 and 40-year-olds and 50-year-olds who have not yet, for the most part, been vaccinated, and their behavior is clearly not within the guidance, this is now what we're seeing, where 20, 30, 40, and 50-year-olds are now being exposed and or contracting the virus. The other variable in this entire thing is that these variants don't really care that you've had COVID in the past. The variant is just that. It's different than the original. So you can be reinfected. So the notion that seems to be rather prevalent in this country a little too much is that I've already had COVID, I'm immune, I don't need to be protected, I don't need to get a vaccine, is absolute nonsense. You do need to get the vaccine, and you still are as much risk as anyone else, even though you've had prior COVID exposure and or a diagnosis. So it's incumbent upon everyone in our county and the state and the country to continue to wear your mask and to continue to socially distance until we can get the majority of folks vaccinated. One other thing that we've sort of talked about, but not really, is the concept of herd immunity. And when we talk about that, it's a majority of the American population vaccinated. As all of you are aware, folks under 16 years of age, which makes up 25% of the US population roughly, cannot get vaccinated. So that puts us automatically, even if every single person over the age of 16 was vaccinated, that puts us at a maximum of 75% of the American population vaccinated. And that barely gets us into the herd immunity level. So the pandemic is not over. We need to continue doing what we're doing. And it won't be over until we get the majority of folks vaccinated and continue to do the things that we've been doing for the last year. It's frustrating, to say the least, from a public health perspective, to see us this so close to the finish line. And then the numbers just go right back up because people think that they got the vaccine. Now they can travel. Now they can do whatever they want to do. I think Florida and the fact they had to close Miami is a good indication of generally how people are feeling. And if that feeling spreads, we're going to go right back to where we were. And potentially start over. The longer we allow these case counts to be this high and continue to grow, the chance of a variant coming out grow exponentially. A variant for which, one, the vaccines may or may not work, and or is far more deadly, and or is far more transmissible. So those are really our options as Americans. We can either continue on the path we are now, or we can sort of reassess what we're doing and put our masks back on, stop traveling, stop socializing, and do what we've been doing to help us get us across the finish line.
My comment a little bit ago was based on, I'm seeing two different pages. When I said it looked like this last week, we had dropped slightly from where we had been from the two previous weeks based on your last reports. I was looking at a 1 week average positivity of 4.1 on the state site. But if I switch to a different metric, I actually am getting a different reading. So the pages don't seem to be agreeing with each other. So.
Yeah, I mean, it looks like we had on the 27th, 1,300 cases confirmed in Colorado, and on the 29th, 2,700. It's a pretty big jump. We also saw, we knew this weeks ago that travel was breaking records as far as during the pandemic, we saw more travel than we've ever seen. I'm looking at a line graph here that is showing other sort of travel heavy moments, and it looks like surges associated with holiday travel tend to last a week, week and a half, 2 weeks. And I think to a large degree, as I think about the history of that, we've also been fairly responsive to those surges in terms of tightening up restrictions, at least in Clear Creek. And I know the Denver metro area has been very responsible, and many of the neighbors to the west of us as well. That might be a messaging tool as much as, you know, a 25% difference in restaurants making a huge impact. So I'm curious, knowing that, hearing you state that we're not likely to move into yellow at all. We would have to get 2 or 3 times as bad as we are now. How do we communicate to folks that this is not over yet and that we are in a moment of danger here and we need to, what's the phrase we've been using? Stay the course, right?
That's a great question, George. I don't know. I'm tired. My team's tired. Everyone's tired. But you have to sort of put your exhaustion aside. Wearing a mask is an incredibly small ask. It has no economic impact in a negative way for people wearing masks. It's not a violation of your personal rights, despite what people believe. It's the second most effective way at stopping the virus spread next to the vaccines. And in combination, those two are highly effective. But the fear long ago was when vaccines start rolling out, the one will fall off, meaning the masks. And that's what we're seeing now in spades. I spoke to my colleagues in Summit, Eagle, Route, Grand, Gilpin, and San Luis Basin last week. The level of absolute belligerence of folks going to the resorts is at an all-time high, according to my colleagues, to the point where there's nothing they can do about it. They just want the ski season to end as quick as possible. They wish the snow would melt because they're driving up the numbers in those counties. And all those folks are driving through our counties. And so there's nothing, and I understand tourism drives the economics of it, but tourism is also going to drive our economics back in the other direction. It's sort of a double-edged sword, damned if you do, damned if you don't at this point. So I don't know, George, what the message is. The message is stay the course, of course. That's what we've been saying from day one. And it's going to take time. COVID, unlike the flu, or COVID like the flu, I should say, is going to be around, like it or not. It's coming back next winter. Our numbers may decrease over the summer months as we did last year. And obviously vaccines help, but like the flu, it very well may mutate into a different variant that we now need another vaccine for and need to wear masks for. Because if we have a new variant next winter that everyone needs to get vaccinated for, we're going to need to roll out vaccines for that. And that's going to take time. And so in order to minimize the spread, we're going to need to wear masks again. As I said before, it's the second most effective way at slowing the spread of this virus. So I get people are tired, but you know, when you're running a marathon and you get to mile 22 and you're really, really tired, you don't stop, you keep running and you sort of forego that exhaustion and get it out of your mind and know that this is a marathon. You got 26 miles to run and you keep that mentality through the last few miles. And that's really where we're at now. You know, I've never run a marathon. I got more sense than to do that. But I've heard that there's a wall, right, that you hit at mile something. And once you get over that wall and you mentally just fixate on that 26 miles, literally that's where we are at in this pandemic, as an analogy. We need to continue doing what we're doing. Otherwise, unabated, you know, these variants are far more transmissible. We're seeing that in spades now with the numbers, you know, 10% increase in a single week. As we saw in England, that happened week after week and suddenly went 40 and 50 and 60% jumps. And suddenly 3 weeks later, you have a surge, the likes of which you haven't seen yet. And that's where we're at now. Yes, we've protected the 60-plus-year-olds, but guess who's filling up the hospitals now? It's the 40 and 50-year-olds. I just spoke to one of my wife's colleagues. She's the head of the trauma unit at Medical Center of the Rockies. Their ICU is filling up with 40 and 50-year-olds who have not yet been vaccinated, who believe somehow that they're invincible. And this new variant is far more contagious and far more impactful, even on 40 and 50 healthy-year-olds. So.
Yeah, I'm looking and I see that, you know, 16% of the nation has been vaccinated right now. That's a long ways from 70 to 90. And we knew this was going to happen, that when people got vaccinated, there would be this feeling of invincibility. And even among those who still realize, and we know cognitively, that we're supposed to wear masks because there's risks associated of acting as a carrier, any number of things. You may be more likely to be an asymptomatic victim, I understand. You may be shedding anyway, but just have a lesser case than you would have.
Right.
And if those things are true, and we're still determining even what levels of transmissivity are there, and we're only at 16%, and the risk to the balance of the population, the fact is that still means that 84% of the population is completely unvaccinated and able to continue to carry and give to each other. And so the mask thing seems to be a given. And it also seems it's a peer group pressure thing. And I want to come back to something that all public officials should be doing with their messaging, which popped up in our meeting last week as a point of conversation for a little bit. When we sow doubt in the need for this at the public level, in meetings like this, in our COVID update, when any of us do that, then we undermine the attempt to keep people behaving responsibly. And, you know, I look at it like when I go out, there's some people that aren't wearing masks because they've been vaccinated and they feel they don't have to anymore because they've taken care of themselves. And then there are others that are not wearing masks because there's less peer group pressure because fewer people are wearing masks. And you don't know who in that place that you went into, if you go into a restaurant or anywhere, you don't know who it is that's been vaccinated and who hasn't, that's not wearing masks, or elsewhere, outdoors. And one thing that's troubled me a lot, again, is this public expression by leaders that continues even right now after everything we've learned. I mean, I'll say that I saw our governor in a feel-good ad, and there was a quick little visual image right at the end of the ad where he was giving the message about what we all needed to do, but how we need to get back to normal. And right at the end, he didn't have a mask on through that, but right at the end, they showed him with a mask back on and ripping his mask off saying, let's get back to normal. And I just thought, so what did that do for anybody or anything to help? You know, just the idea of let it go. We all want to get back to normal, and then expressing that visually, with that example.
Randy, I had the exact same reaction when I saw that ad just the other day. I want to state for the record, and so the constituents that you have and are around the county, when the governor makes this decision, you'll know it's not based on science. CalFO and all of the public health directors in the state of Colorado wrote a letter last week and gave it to the governor requesting that he not remove the mask mandate at a minimum before the end of May. That it is the single most effective, short of vaccines, the single most effective way at reducing transmission. And it was the public health director's unanimous opinion that we need to keep that in place until the end of May. We know the governor is considering otherwise, and to your point, Randy, and it's mind-boggling. And the reason I say it's mind-boggling is because the governor has made it clear that he wants to vaccinate anyone and everyone as quickly as humanly possible. Well, the most effective way to limit that ability is to put out commercials like that. Because if you convince the Coloradan people that the pandemic is over or almost over, you are going to eliminate a segment of the population who now believe they don't need to get a vaccine because the pandemic's over. Why would I get a vaccine? I'm not at a very high risk. So it's mind-boggling why the governor continues to put that message out of we need to open up economically. We need to get back to normal as quickly as humanly possible. How about let's focus on the vaccine and vaccine rollout as best we possibly can and continue our message that we've had for many, many months now, instead of giving people this false sense of reality and then, strangely enough, asking them to get vaccinated. It just doesn't make any sense. Well, it makes sense from a political perspective. It makes zero sense from a science perspective. So in 2 or 3 weeks, when the governor removes the mask mandate and pretends to give counties the authority and the independence to make that decision themselves, know full well that the governor is doing that at the opposite of the advice of the experts who are actually in this state. Just from a political perspective, you should really understand that. He's been advised not to do that, and he's likely to do it in the next several weeks.
Well, I'm a firm believer in the subliminal effect on behavior of visual images like that. And just the fact that, you know, no matter what you said throughout that entire commercial, just the fact that you tore off the mask, I mean, it elicited in me a response that was like, yes, please, you know, set my people free. You know, let us go, you know, because I wanted to feel that. I wanted to let all of that go. And I thought it elicited that response in me. And that means it elicited in a lot of people that will just, that will maybe not even hear the words if he said, continue to wear your mask, but they'll just see him ripping his mask off, because we all know we all want to get back to that. It's an encouragement to do that. And you're right. I think I would believe anyway, that once we decide that that's okay, then even if we don't decide not to get a vaccine, our incentive to hurry up and get it done and go online and find that opening when it comes is less, to do the work that it takes to make it happen. And so I think George asks a great question. How do we overcome that for our population? And then secondly, how do we remain safe if the governor opens up the state and leaves it up to the counties, and you're surrounded on 2 or 3 sides by counties that have, you know, that decided they couldn't make it happen? So how effective are you at making it happen, at limiting transmission in your own county?
So I guess the good news is my peers in Summit, Eagle, Route, Grand, and the other counties around us are all in agreement that we need to continue to have a mask mandate in our counties, regardless of what the governor does. We've also informed the governor that when you remove the state mask mandate, as we saw initially, right, it was a hodgepodge and a piecemeal county by county, and it was almost impossible to enforce. It makes it much simpler to enforce when people enter Colorado and they understand statewide this is a mask mandate. It's much simpler to enforce. When you have a piecemeal, it makes it very difficult. But the counties around us are all in agreement, at least the public health directors are. And from their comments, most of the Board of County Commissioners or Boards of Health in those counties are in agreement as well around keeping the mask mandate. But it will make it much more difficult. I think in Clear Creek, we need to continue to have a mask mandate for all the reasons I've already stated. It will also allow us to keep schools in session for the foreseeable future and through the end of May until they're done for the summer, which is also one of our top priorities to keep that going. So I mean, I don't know what, George, more we can do than we already are doing, than we already are saying in public meetings and on every single call that I and staff are on, trying to promote this. It's unfortunately going to require the governor to stay the course, and not be blinded by that shiny object in the corner. It's frustrating to watch, because as soon as he removes the mask mandate, it's going to make everybody's life a heck of a lot more difficult. And I understand he announced yesterday that everyone 16 and over is now eligible to get a vaccine. That's wonderful. Except we haven't been flooded yet with vaccines to vaccinate every 16-year-old plus. So, and my first question to his chief of staff was, does that mean we're going to get more than 100 doses a week now that you've opened it up to everybody? For which I did not receive a response.
Thank you for that, Tim. And as I asked the question, I realized that it's not a question to put on any one person's shoulders, right? If somebody had the answer to that, then we'd be in a better situation. So I want to get to the questions that have been typed into us. First one, how many first dose? I'm qualifying this question because we know the second doses equals the number of second doses that people need to get. How many first doses and Johnson & Johnson vaccines did we get this week?
We had 0 Johnson & Johnson. I'm trying like hell to get Johnson & Johnson so that we can vaccinate all of our frontline workers in the county. Last week, the state received 30,000 doses. Despite what we were told that those would be going all to LPHAs, they all went to the mass vaccine clinics that are going on around the state. So we did not receive any Johnson & Johnson vaccines. We can't even order them in our ordering process. We're hoping that changes in the near future. Moderna, we have 100 doses this week of first doses. We're asking for 500 or more each week, and we received just 100.
Okay, thank you. And Randy, I saw you on mute. I don't know if you have anything.
Yeah, I was about to ask the question on Moderna, and then he answered the question. So.
Okay.
And we don't have Pfizer. So folks who are interested in getting your child who is 16 or 17 vaccinated, as am I, fall into that category, my eldest daughter, we had to register her through Summit County. They are the closest one that I think is realistic in terms of getting in. Jefferson County, good luck. Other counties, we don't have Pfizer here in Clear Creek, so we obviously can't accommodate. Moderna is for 18 and over, so we cannot vaccinate your child who's 16 or 17. So please don't bring them. We will not vaccinate them. So I would reach out through Summit County. Their process is the same. When you enter your address, just put in Summit as your ideal location as to the county on the bottom. And then that will, similar to our process, basically when there are vaccines available, they will email you to schedule your vaccine. So.
Okay, and the mass vaccination sites, those aren't intended for any specific community, right? The folks in our community should not feel any hesitation about trying to get to those mass vaccine sites, correct?
Correct. There is one in Denver, or at Dick's Sporting, I don't know what town it is in specifically, but Dick's Sporting Event Center. There's one up in Larimer County at the ranch. There is one in Colorado Springs, one in Grand Junction. I believe there is 7 total across the state. The governor has this notion that he can get all 7 of them up and running at 6,000 doses a day, which I think is not realistic in terms of the actual numbers they're able to do. But the one at Dick's Sporting Goods is probably the closest for our folks in Clear Creek County. The challenge with those, when you try to vaccinate 6,000 people a day, is the line gets long, and you have to wait in line like your average Georgia voter.
Okay, so next question. What's going on with the outbreak in the jail? Last week we had 4 total cases. Do we have any additional?
There are 4 confirmed cases, 1 suspect case total. We believe it is fully under control. No additional cases, no additional symptoms at all. Those inmates were all tested last week. I don't recall the day. All those results came back negative for the remainder of the folks in the jail. So we are fairly confident that it is fully under control. Everyone is in isolation and quarantine. So the potential for spread is more or less non-existent.
I see Sean on the attendee list too, Beth.
Glad you have an eye on that. Okay, so, and thanks to Sheriff Rick Albers for being so on top of that and our public health team. Okay, next question. Current quarantine recommendation for travelers returning to the county if they are fully immunized, as in 2 weeks after they received the vaccine. So if you're fully immunized and you travel, are you still recommending quarantine when you return from travel?
Given the significant uptick in variants across the country, yes, I would recommend that, particularly if you're traveling by airplane. By car, it's actually obviously much less probability, but given the variants in this country, yes, we're still recommending at least a 5-day quarantine post-travel.
Okay, thank you for that. I know it has not been brought to, we have a policy that is to that effect with our staff, and it's not been brought to us to change that policy. Last one that I've got in writing here about variants. Have we identified any more variants in the county? And this is a 2-parter. Did we ever find out, I know we had identified one of the variants in our county, and did we ever figure out which one of those it was? Or not figure out, was it ever disclosed to us?
Yeah. So several questions there. Yes, we do have an additional case of variant in our county. No, we have not yet learned what variant that initial case now almost three weeks ago was. We're waiting for the state lab. We have absolutely no control over that. They are the ones doing the analysis. And so until they tell us, but to be quite honest, whether it's the UK variant or the South African variant, it doesn't really change anything that we're doing. Yes, that information would be helpful to know, but it doesn't really change anything that we're actually doing on the ground. So we are waiting patiently for the state to respond back to us.
And it's not the case, what am I trying to say? We don't know whether every positive test is a variant or not, right? They take a subset of the positive tests and send them to the state for further analysis, because the test won't say you have this and it's the UK variant. Is that correct?
Correct. Yeah. And so and different labs are doing different things. So for instance, COVID Check Colorado, the testing site that is in Clear Creek County, they are not actually testing for variants. Mako, which is in Summit County and many other counties, actually is. So what happens is you get your test, it goes to their lab. They can identify if it's either the original and or a variant. If they see that it's a variant, they'll send it to the state lab. The state lab then does even further analysis, trying to understand which of the variants it is. In addition to that, the state receives lab results from all of the nursing care facilities in the state, and for the most part, all of the prisons and testing that's done in prisons in the state. So they get a fairly broad sample from across the state. They don't specifically get it from Clear Creek County, and the only reason those 2 cases in Clear Creek County that we know that they're variants is because those folks were actually tested in other counties, utilizing Mako as an example, and that's how that came about.
Okay, thank you. That is, wait, did we get one more? Yeah. What's the process to reschedule COVID tests if you were scheduled and your test was canceled today?
Testing will be back next Tuesday, barring any weather. So you don't really need to schedule yourself. So for the testing that we have now, you can literally just show up. If you want to pre-register again, go right ahead. But you don't need to. You can just show up on site and get tested next Tuesday.
Okay, and then of course I know Jefferson County and Summit both run tests at a greater frequency, and
Right.
I've gone to both counties to get tests. So to the person who asked that question, there's other sites that are available. And Sean, I want to welcome you here. I know you had a meeting that you couldn't miss, and we weren't talking any policy decisions that the county would take. So I don't think there's much to update you there. But I want to, open it up in case you have any comments or questions.
I don't think so.
Sean, I did your age outbreak that you asked for the last 2 weeks.
Oh, yeah.
In terms of our cases, just for curiosity's sake, I can run through those real quick. We had 1 teenager, 5 individuals in their 20s, 7 individuals in their 30s, 6 individuals in their 40s, 5 individuals in their 50s, no 60-year-olds and 1 70-year-old. So I think what you're seeing there, as I stated earlier, is a clear delineation of folks who are vaccinated and those who have not yet been vaccinated, and or are acting like they, because we did have 10 folks in the last 2 weeks who were post-vaccine and became COVID positive. As far as when they were exposed, whether it was the 2 weeks prior to their vaccine and or within that 2-week window post-vaccine when they got exposed. So, but a vaccine does not make you bulletproof, as we see in those numbers.
It makes you 90% bulletproof, right?
Pardon?
It makes you 90% bulletproof.
Yeah, if that's helpful. So quite a broad spectrum. The other thing we're seeing that you may have missed is that we're now seeing those age groups actually end up in the hospital. So the variants are a little bit far more, I'm not even sure what the word is, not quite deadly, but more likely to put you in the hospital, even if you're in your 40s or 50s. In those numbers, I mean, that 30s, 40s, and 50s are really the highest groups.
Yeah, that kind of makes, that makes sense. Thanks.
Okay. Well, I don't have any additional questions, Randy. I don't know if you do. I don't see any others coming up in the chat.
No, other than, if this is the last word, I just say, keep your mask on. We heard it from Tim, regardless of whether you've been vaccinated and your percentage of probability.
Regardless of what the governor says.
What about so one thing I did miss, and I'm sure you must have brought it up, what's our, what expectations do we have in terms of the vaccines we'll be receiving over the next few weeks and months?
That's a great question. Well, as you probably know, yesterday the governor made every person eligible 16 and above for vaccines, which is wonderful. But we have not received, we've asked for in excess of 500 per week over the last several weeks. This week we received 100 of the Moderna. We're unable to actually order Janssen vaccines as of right now. All 30,000 we received last week, the state that is, all went to these mass vaccination clinics ongoing across the state. And we were told, the LPHAs, that we would be receiving those vaccines, which clearly didn't happen. So we're going to continue to push for the Janssen vaccine, primarily because we want to vaccinate close to 1,000 folks who are Clear Creek's frontline workers, grocery stores, restaurants, etc. We have them already lined up and ready to get vaccinated. We just need to receive those vaccines. We have not received any word as to when we will be able to order those Janssen's again. As far as the Moderna vaccines are concerned, we've been told for weeks now, as I've relayed to you guys, the floodgates are opening and we can anticipate a significant number of doses. But when we order 500 and only get 100, it doesn't suggest to me that the floodgates are opening. They've opened a bit, but not to the level that we were anticipating, both in Clear Creek and across the state, all of my peers. So short answer is, I don't know. I hope soon. I hope that we can get the Janssen vaccines, because we could literally vaccinate that 1,000 people in a week, and really give us a level of protection on our front lines across the county, which would go a really long way, in my opinion. But, you know, I'm hopeful. Tomorrow we have our call with the state, and so we'll see what they say, but it seems sometimes what they say and what turns out to be reality are two very different things.
I know that at one point, I think it was you, Tim, who mentioned we felt comfortable at 4,000 or 5,000 a week that we could administer with the team that we have in place. So I'm kind of wondering, why don't we order 4,000? I mean, what makes us think that ordering 500 is the right number?
Well, when we order 500 and only get 100, I don't know what ordering 50,000 would do.
Maybe we get 20% of what we asked for. I don't know. That's what I'm just asking.
Sure. Yeah. Okay. We can try. We have in the past, just for the record, we have in the past ordered more than 500 and only got 100. So we've tried that before. It didn't result in anything, but you know, times they are changing, as Bob Dylan said. So we'll see. Next week we have 600 plus second doses we're administering. So I don't know yet how many first doses, if any, we're going to actually order, but we'll see. It's, you know, all dependent on supply. We really hope the state gets a significant increase in both the Moderna and Pfizer. And that's the challenge, right? We, Clear Creek County, need the state to receive a significant number of Moderna. Pfizer, we're not administering. The Janssen, it's clear now that the state is going to be shipping those off to the mass vaccination sites. And so it's the Moderna number that needs to really go up significantly for us to actually get the 500 or 1,000 or 2,000 or whatever. And so we have not yet seen that.
Do you think the state's focusing J&J on these large sites just because then those large sites don't have to bother with the record keeping associated with administering second doses and all the rest of that? I mean, I guess that would be a reason why it would make sense from my perspective.
Yes. In addition, keeping 6,000 doses cold or frozen throughout the day is a logistical challenge. The J&J can be stored right in the refrigerator from the get-go. So logistically, from that perspective, it's much simpler. Plus, what you just mentioned, and it's the reason and the rationale we want 1,000 to vaccinate our frontline workers, so that it's sort of one and done. And that immune system starts kicking in and is at full throttle 2 weeks in, not 6 weeks from now. So,
Sure.
I've given up trying to explain the rationale or whatever you want to call it that the state uses.
So just from like a fairness perspective across the counties, do you have any feeling, Tim, whether, because I remember we all got kind of annoyed, whatever it was, like a month ago. And the reason we got extra, or I got extra annoyed, is because if you looked at us on the stack ranking of all the counties, we were in like 4th to last place or something like that. And I know we made a little bit of a public stink about it. And then voila, 1,500 vaccines showed up shortly thereafter. Do we feel like the reason why we're not getting what we need is because no one's getting what they need right now? Or is it another situation where we could squeak a little bit louder and maybe get a little bit more fair treatment?
No, I think the discrepancy still exists. I think some counties to the west of us are receiving more than their share on any given week, and that didn't really change. We did get a bump of those 1,500, and then the following week of 500 doses, but that was sort of a one-time thing. I think the governor, and this really goes back to the governor, right? The governor has a team, but it seems there is an I in team. And he is the one mandating and dictating everything. And it's his notion that these 7 massive clinics around the state are what is going to pull us through this, which is it's a false reality. The public health are really what's going to get us through this, and not these mass vax. People aren't going to drive 200 miles to get to a vaccine when they could far quicker get it from their local public health, has been the sentiment of my peers across the state. So, but the governor is hell-bent on making these 7 pods the answer to our problems. So he's, as an example, last week, put all 30,000 doses into these 7 clinics. And really taking them away from LPHAs. I don't know the rationale behind that. He thinks that if you do 6,000 a day, 7 clinics times 7 days a week, because that's what he wants to do, that somehow everyone's going to make their way and wait an hour or wait in a line for 3 hours to get a vaccine. I don't know. It's
Okay. Well, it is 11:50, and I know that KGO tends to schedule interviews at the end of our scheduled 30 minutes here. So I don't want to keep them waiting much longer. Very grateful to the volunteers for staying in the station down there. That said, do we have any final burning questions or statements?
please keep wearing your masks.
I was going to say that again. Just it turned out to not be the final word by about 5,000 words. So I thought I'd throw it back in. Wear your mask.
We will order as many vaccines as we possibly can, and administer as many vaccines as we receive in every given week, and vaccinate folks as quick as we can. But until we reach that threshold, getting rid of mask mandates is a huge political mistake. We are in the middle of a pandemic, and politicians are the last people on earth you should be listening to for health advice. You should be listening to the public health experts. They don't care about I don't care about politics. I don't need to get reelected. I care about protecting the health and well-being of the citizens of our county and of the state and of this country. That's my primary objective. So when you listen to someone, you should always think about their perspective and why it is they're saying to you what it is they're saying. I don't have any ulterior motives. My ulterior motive is to protect the health and well-being of the citizens of this county and of the state. And so I'm going to continue to do that as best I can.
And I just point out that Randy and I are term limited, so you can trust everything that we have to say in this matter.
Yes.
Sure.
Even when we disagree, you can trust both of us, even though we say opposite things.
Yeah, I would just like to state for the record, Sean and Randy and George, kudos to you guys for keeping this out of politics, at least your decisions and the things that you put forth for the county. Hats off to you, because you're in the minority, unfortunately, in this country in terms of what politicians are doing. And it's unfortunate. But I'm feeling fortunate to be in this county and to have leaders such as yourselves to continue to do the right thing and to continue to lead based on facts, not politics or personal opinion, but just the facts is really, really helpful. So thank you.
Thank you, Tim. I respectfully disagree. I interact with local electeds all over the state all the time. A lot of really high quality people around the state that are really working hard on this. And
Yep. I think it's another case. Sorry to interrupt, George. I think it's another case of minority giving a lot of people a bad name.
Yep.
Honestly.
Yeah. I've heard some horrifying things, and the vast majority of folks are really serious, really dedicated. So,
yeah, just a quick example of that is there's, legislature related to Board of Health. It's because of one county.
There's a handful, but that's okay. We can let's take this conversation to the bar somewhere else.
No, the bar.
That's a really dumb thing to say. The virtual bar.
That can't be the closing words.
That can't be the closing words. The closing words are wear your mask. Thank you everybody for listening. We'll see you next week.
Thank you.